In many ways, the other extremely common gram-positive coccus, streptococcus, behaves very remarkably like staphylococcus. There's a few differences, and let's kind of just summarize them. With the strep family of bacteria, there is a division into A, B, C, D, E for various types and species and so forth. But probably a more important and independent type of division is what kind of hemolysis they would cause. So often you'll hear the strep classified as alpha hemolysis for alpha strep, beta hemolysis for beta strep, and there's even a non-hemolytic type. The beta hemolytic strep right here are the most important ones and the most dangerous ones because they cause a more complete pattern of hemolysis. Like staph, the strep can infect just about anything, basically skin, wounds, upper, lower, respiratory infection. As you remember, the strep group of bacteria are the most common cause of the classical lobar type of pneumonia, which we'll get into when we talk about the pulmonary system. The strep also have a remarkable propensity for causing endocarditis, infecting heart valves. And like the staph, they can cause a fasciitis, soft tissue, skin, and so forth. But different from staph cocci, strep gram-positive cocci have a few diseases which they may not cause directly, but they're linked to. So when people have scarlet fever, is that perhaps caused by a strep directly? Well, possibly, but it's really more the effects of the scarlet fever is a condition that follows a strep infection. By the same token, a child or children or anybody that has rheumatic fever has a history of a previous strep infection as well. And of course, the most classical acute childhood type of glomerulonephritis, formerly called post-streptococcal glomerulonephritis, is now generally just called acute glomerulonephritis. The point I'm trying to make is that the big difference, one of the big differences between strep and staph is that strep is associated with sequelae of diseases which may not be caused by the bacterium directly, but is known to follow the strep infection, like scarlet fever, rheumatic fever, and glomerulonephritis. Another disease that's almost unique to strep is a disease here which we see a picture of called Erisipelas. I hope I'm pronouncing it right. It's a disease of immunocompromised hosts, often the very young and the very old, and it causes diffuse reddening of skin, and this is a classical case of it. Okay, let's talk about some rods now, or the bacilli. And it's probably easy to run down and classify the gram-positive bacilli or the gram-positive rods to begin with, because there's only a relatively few of them. Almost all of the other rods or bacilli are gram-negative. So often the term gram-negative rod is almost redundant. But there are a few diseases like diphtheria, listeria, anthrax, nocardia, clostridium, which are caused by gram-positive rods. And it's not my desire to go into the details of all these diseases. We may do that when we get into the organ systems, or we may not, but I think it's worth saying a couple words about each one. Diphtheria is a serious disease that is really no longer seen because of immunization, at least in this country. It's a severe upper respiratory tract illness. It's characterized by a sore throat, low fever, and there is an inherent fibrinous membrane which adheres to the pharynx and the tonsils or nasal cavity. Is called a pseudomembrane. So when you hear the term pseudomembrane referring to a thick fibrinous exudate associated with a severe upper respiratory infection, they're usually talking about diphtheria. Listeria is a type of is several things. One of the things it is, it's a foodborne infection that has a very, very high fatality rate, perhaps around 25%. Um, it's also a cause of meningitis in newborns by virtue of the fact that it has a remarkable propensity to infect the placenta. And many of the newborn infections that are gotten through the placenta are from listeria. Anthrax, we have heard so much about this in terms of bioterrorism. Classically, Bacillus anthracis is an infection of which can be gotten from either oral inhalation or cutaneous routes, and it is a feared agent of bioterrorism. Nocardia or nocardiosis is a gram-positive rod. Some people think it's kind of related to fungi as well as in its properties. That classically causes respiratory infections in immunocompromised hosts. So if you hear somebody has nocardiosis, chances are they're immunosuppressed through one method or another. It would not be fair if we didn't say a couple words about Clostridium. Clostridium is the last gram-positive bacillus or gram-positive rod in this group, and it's a very important cause of food poisoning. It has several different species. Clostridium botulinum releases a toxin which causes a severe type of food poisoning. Clostridium perfringens is the most common cause of gas gangrene. It's an aerobic bacteria that generates gas. And of course, Clostridium tetani is the causative agent of tetanus. So I feel like we have probably adequately run down gram-positive rods. Let's talk about the gram-negative cocci now. And there's only really one genus, it's Neisseria. And Neisseria gonorrhea is the cause of gonorrhea. Neisseria meningitis is one of the leading causes of a epidemic type of meningitis, a feared type, and it is not the usual childhood type, which is Haemophilus. This is in older people, children, older children, young adults, old adults. So I don't know, my taxonomy may not be perfect, but to tell you the truth, I really can't think of any clinically important gram-negative coccus except for Neisseria. And of course, if you did a gram stain on these, your algorithm would be, once again, to look at the organisms. Are they round, cockle, or are they long, like hot dogs or bacilli? If they're red, they're gram-negative because of the counter stain, and if they're blue, they're gram-positive. So red balls are gram-negative cocci. So let's get into our last group here, called gram-negative rods. Most bacilli are gram-negative, and they cause a wide variety of infections. Some of them live normally in the colon. They cause a wide variety of pulmonary, renal, soft tissue infections. And whenever you hear a discussion about the gram-negative rods, E. coli is always at the top of the list, whether it's a colon infection or a urinary tract infection, perhaps a neonatal infection. So you always have to remember, when you run down the gram-negative rods, E. coli is at the top of the list. Technically, all these other bacteria stain gram-negative as well, and we'll finish running them down in the next 10-minute clip. And I thank you very much for now.